All right, let's dive right in. Today, we're talking about a fascinating drug called acetazolamide. Now, if you've ever planned a trip to really high altitudes, this name might ring a bell.
So picture this. You're getting ready for a huge adventure, maybe climbing Kilimanjaro or trekking to Everest Base Camp. Your doctor might hand you a prescription for this stuff to help with that awful acute mountain sickness. But what is it, really? And how in the world does it help your body deal with thin air? That's what we're going to unpack.
So here's our game plan. We'll kick things off with what acetazolamide actually is. Then we'll get into the really cool part, how it works. After that, we'll cover when it's prescribed, who definitely shouldn't take it, what the risks are, and wrap up with the practical stuff, the nitty-gritty details.
All right, first things first. Let's get a high-level look at what we're dealing with here. Okay, so acetazolamide is what's known as a carbonic anhydrase inhibitor. Yeah, I know, that's a mouthful. But all it really means is that its main job is to block a very specific enzyme in your body. But it's kind of a multitasker. It also acts as a diuretic, which means it helps you flush out extra fluid, and it can even be used as an anticonvulsant to help with certain seizures. Pretty versatile, right?
So you're probably wondering, okay, blocking an enzyme in my kidneys, how does that help me on a mountaintop? It doesn't seem to connect, right? Well, it's all about how it works. Let's take a look inside. It all boils down to this cool three-step process happening inside your kidneys. First, acetazolamide goes in and blocks that key enzyme, carbonic anhydrase. Think of that enzyme as a gatekeeper that controls a specific chemical exchange. So by blocking the gatekeeper, the drug basically halts that exchange. And the result? Your body is forced to flush out more bicarbonate, sodium, and potassium through your urine. Now this change in your body's chemistry, that's the magic trick. It's what helps you acclimatize by essentially tricking your body into breathing faster and deeper.
So how fast does this stuff actually get to work? Well, it really depends on how you take it. If you take a tablet, you're looking at about 1 to 2 hours for it to kick in, but the effects can last for a solid 24 hours. But check this out. If you get it through an IV, it's almost instant. We're talking 2 to 10 minutes. The trade-off, though, is that the IV's effect is much shorter, only about 4 to 5 hours. Now, you might think this is just a mountain drug, but it's actually used for a whole lot more.
I mean, look at this list. Its main claim to fame is, of course, acute mountain sickness, but doctors also prescribe it for edema, which is basically fluid retention, often seen in folks with chronic heart failure. It's also a go-to for treating glaucoma because it can lower the pressure inside your eye, and like we mentioned before, it helps with some seizure disorders. It's a real workhorse of a medication.
Okay, let's shift gears to something really important. This is crucial safety information. Like any drug, acetazolamide is not for everyone, so we need to be crystal clear about who should stay away from it.
So here's the big one, the absolute #1 warning. If you have an allergy or hypersensitivity to sulfa drugs, you cannot take this. Acetazolamide is what's called a sulfonide derivative, so it's in the same family. A bad reaction to a sulfa antibiotic in the past means this drug is a definite no-go. On top of that, it's also contraindicated for people with low sodium or potassium, a condition called metabolic acidosis, or any significant liver or kidney problems.
All right, so even if you can take it, it's not without its risks. Let's talk about the potential side effects and interactions you need to be aware of. Some of the more common things people experience are tinnitus, that's a ringing in your ears, and your typical nausea or diarrhea. But because of the way it works on the kidneys, you have to watch out for more serious things too, like electrolyte imbalances or that metabolic acidosis we mentioned, where your body chemistry gets thrown out of whack. This is why a doctor's supervision is so important.
And this is where things get really serious. The clinical literature is very clear, and I'm quoting here. Acetazolamide has similar adverse reaction risks as sulfonamide derivative medications, including Stevens-Johnson syndrome and toxic epidermal necrosis. Now, these are incredibly rare, but they are also extremely severe, potentially life-threatening skin reactions. It just drives home why that sulfa allergy warning is so critical.
You also have to think about what other medications you might be taking. For instance, if you take it with a urinary antiseptic called methenamine, it can cause insoluble particles to form in your urine, which is not good. It can also ramp up the toxicity of another drug called cisapride. So always tell your doctor everything you're taking.
Okay, we've covered the what, how, and why. Now let's get into the practical details. How is this stuff actually dosed?
If we're looking at the standard dosage, for an adult, it's typically based on your body weight, with the dose maxing out at 250 milligrams, and you take that by mouth every 12 hours. For kids, the math is similar. It's still based on weight, but the maximum dose is lower, at 125 milligrams, also twice a day.
And finally, let's touch on a few really important special cases. For anyone who is pregnant or breastfeeding, there's just not a lot of data, so it's a proceed with extreme caution situation. If you have kidney problems, the dose absolutely has to be lowered because your kidneys are doing nearly all the work of clearing this drug from your system. And here's a surprising one. For kids, it's actually not recommended as a preventative for mountain sickness, unless it's a very specific, high-risk case.
So when you step back and think about it, acetazolamide is pretty incredible. It intentionally alters a basic function in our kidneys, all to help us survive in an environment we're not built for. It really makes you wonder, doesn't it? What other fundamental processes in our own bodies can modern medicine safely influence to help us push our limits? That's a big question to chew on. Thanks for digging into this with me.